Hi, this is Leslie Thompson with the Weight Loss Surgery Channel, reporting from the 2009 annual conference of the FASMBS. And I'm joined by Dr. Jaime Ricardo Ramos Kelly, who is a bariatric surgeon in practice in Tijuana, Mexico at Angeles Hospital. Dr. Ramos Kelly, thank you so much for joining us.
Thank you for inviting me.
Now, we have not spoken previously with any surgeons who are based in Mexico, and medical tourism and having U.S. patients travel across the border for their bariatric procedures is a very controversial topic.
It is indeed.
So I wanted to hear from your perspective as a doctor who's practicing in Mexico and serving a lot of U.S. patients. What are some of those pros and cons?
Okay, well, I provide the medical services for American patients. I offer them a very state-of-the-art facility. And we would like to separate ourselves from the people that are not professional and they get this type of patients. I want to assure the patients that they are going to get the same level of care as in the United States with an affordable price. And I always say that this is not something that is inexpensive for them. It's only that it's quite expensive in the States, you know. And we provide the same services as in the United States. We follow the guidelines of the FASMBS. So we are in this because we want to provide services. And we are at the border, and it's very convenient for the patients to come and see us.
But not all of the bariatric surgical centers in Mexico follow FASMBS guidelines for the practice.
Not at all.
So, and you actually do the whole breadth of bariatric procedures. You do lap band and bypass and sleeve, is that correct?
That is correct.
Are you seeing particular trends in terms of patients coming for one certain kind of procedure coming to Mexico?
Well, at the beginning it was the gastric band, you know, and now we're getting more and more patients for the gastric sleeve as well. And I do the gastric bypass, not that much anymore. I reserve that for a subtype of patients, a subgroup of patients. I'm sorry.
Now, you actually mentioned with the band, we spoke earlier, and you said that you've been using the gastric banding procedure in Mexico longer than in America because it wasn't approved by the FDA until a few years ago in the States, but it's been around in Mexico for some time?
It's been around in Mexico for longer than the United States. Actually, we were training the surgeons from the States in Mexico, and now they have their own proctors. They don't have to go to Mexico anymore. But we've been in this business for longer, and we have more experience with the band than in the United States.
Now, obviously, the primary component for successful weight loss surgery is not just the surgery itself, but the long-term lifestyle changes, the aftercare support, the follow-up, particularly if it's a band and a doctor now or a patient now needs to get routine fills. How does that work if they go across the border for their surgery?
Okay, yes, as you mentioned, the surgery is the first step. Only the first step. They have the aftercare is even more important than the surgery, you know. But you have to perform the surgery first, very efficiently, and then we work with American doctors and with American companies that can provide the follow-up for some patients that they are not near us. They're very far away from us. And but I do follow up. I follow up my patients also by phone, and I follow them. In my informed consent, I tell them that they have to come with me at least once a year.
Regardless of the procedure that they've had.
Regardless of the procedure, because I need to know how they're doing. You know, this is something that is you have to interact with the patient for a long time. So if I just place a band and I don't know what happened to that patient, nothing happens, you know, to the patient. He's going to fail.
But if they do have a band, then you're coordinating with surgeons back in the United States to make sure that that patient has an appropriate facility to go to get their fills and to get those routine checkups? Yes,
of course. There's something called Field Centers USA also, and it's based in the United States. And they can go to those places. It's spread around the United States, and you have nurses, registered nurses, do the fills. They offer to do that, and they follow up with their primary physicians and everything. And this is very important to work with as a team. Yes.
How do you see the trend taking shape in terms of whether you think there will be more medical tourism, particularly with some of the healthcare reform changes that are happening in the U.S., or do you see a drop-off? Where do you see the industry going?
Well, if that is going to happen, of course, patients are going to stay in the States more than now. It's not affordable for them to get surgery here, because only 1% of the obese population in the States are getting the surgery.
Interesting.
Yes. So I don't know how that is going to impact us in Mexico or elsewhere, you know, but it's a good thing, you know, reform to the health system, and I put it that way.
Some doctors would disagree with you. Well, Dr. Ramos Kelly, thank you very much for your time. It was very insightful.
Thank you very much.
And thank you for joining us today. I'm Leslie Thompson for the Weight Loss Surgery Channel.